And then the fly just flies in fetch, and then they defecate and then drop
And the
maggot.
now
So they just saw something swimming in the air, and then they brought the grandmother actually brought the child to the hospital. So we had to pick out those maggots and then take care of the ear.
Okay, so now we've seen that of the ear, the nose.
Yeah, the nose, yes. We've had foam, tissue paper, piece of paper, bead, button.
This time men group with children,
The children.
1 to 5.
Well, yes, but funny enough, within this year, I've seen a 16-year-old, I've seen a 14-year-old. In fact, the 16-year-old was in the body and had a bolt. This bolt for cars, in the ear. 16-year-old. So sometimes you will say children, but you could
You also have
once in a
elaborated
while.
the teenagers. Okay, then that of the throat.
Then that of the throat. This toy is basically parts of the toy.
Swallow.
The swallow eats. Then it could be fish bone, it could be chicken bone.
Okay, now the bone.
The
Anybody?
bones, yes. And then you see this, after actually seeing the child, when he was breathing, you felt that it was, this is the toy that they were pressing. The whistle. It was just, So the child accidentally had it. And then when we look at foreign body in the throat, one, it could go into the airway, which could cause blockage of the airway. And it could even go into the food passageway, that is the esophagus now, and then blocks there. So the way the child will now present will differ. And sometimes parents may not even know, caregivers may not know. The child just picks it and then.
Yeah, for children, 2 seconds, once you just blink, turn, they've done something.
So we've seen that. So even the fish bone too, even in adults, we've seen that. Maybe eating fish and then maybe doing 2 things at a time, talking, gisting and all. We've even seen beer cover bottle.
Well, thank God I'm not a doctor because Dr. Michael seem to have seen a whole lot of foreign bodies where they are not supposed to be. Now you see the cover, the cork bottles, the button, the cotton boards, everything is legible, ear, nose, and throat. These are not just where they are supposed to be. All those things are supposed to be in the trash bin, but where are we seeing them? In the ear, the nose, and the throat. Okay, now when one have a foreign body, the missalada and the ear, the nose, or the throat lodge there, some person will say they don't have pains, but they know something is just there. So how do you determine that this thing is actually foreign? And would there be a symptom of identifying, okay, it's painless, but it's there?
Yes. Sometimes it's just like in the nose, for instance. A child could be playing and just drop something in the nose. You can see the mother come and tell you that, I've noticed that there's something smelly from one side of the nose. As a doctor, the first thing you think is foreign body in a child.
Okay, so presentation could be smell.
Foul smelling discharge
smell.
from that particular nose, the nose.
Okay.
Sometimes there could also be, they saw it. There could have even been attempts at removing, and then maybe they pushed it further in. Or they could have that feeling that, I can't breathe well from this nose. Things that may be a pointer. There's a foreign body. In the ear also, there could also be this history of, I'm not hearing well with this ear. Or we could see something in the ear. It's looking white, it's looking black, or it's looking metallic, it's looking like a gold color. Maybe earrings, even in adults. This hook of earrings, while trying to pin and then suddenly accidental editing falls into the ear.
And you're trying to bring it out to push it further.
They push it further in. And then for the throat also, we could see onset of difficulty in breathing. The child will suddenly, and maybe when you ask, they'll say, they've been treating for asthma, or but the thing just started suddenly, the difficulty in breathing. Or you could see a child or even an adult who's having swallowing. There may not be pain, but in that tells you that he's not able to swallow, difficulty swallowing, and then he's pouring ever from the mouth because of the obstruction there. That tells you that that one is in the food passageway. But if it's in the airway, you could have problems with breathing. Or the breath, there's noise when the child is breathing. So that also can tell you that yes, something has dislodged into the airway.
Okay, now, sir, caregivers, because soon the kids children will be back to school. Even like you said now, it could even be adults. So it's very pertinent that when we have kids playing with toys, we need to be to make sure that the toy parts are complete when they are done playing.
Yes, and also the toys these days, even as parents, uh, it's not just toy. We've had a child who, that child is about, that child is, is it 8 months, no, 4 months, 3 months old, that had this battery of the father's car remote.
3 months.
3 months.
How?
Well, the remote for the car, this, the kick, they kept it there. The child was just playing, and somehow suddenly the battery was removed, and then it was in the mouth and swallowed it, and the thing got stuck. So one will look at those toys. They should have protect, like for those with the battery, especially those compartments. Most of them should have screws. So even when we unscrew them to change the battery, not just discarding the battery, which would ensure that we put the driving the screw after removal, because those are protective mechanisms to prevent. So it's not just looking at completeness, also carefulness with handling of these toys, and even being mindful of the kind of toys we buy for our kids.
When you said your opening caption on kind of foreign bodies, it talks about living and non-living, vegetables and vegetative and non-vegetative. Now let's look at the vegetative, because I really want to understand that.
Yeah, vegetative foreign bodies are things like corn, beans.
Okay. And seedlings are greens.
Yes. So when you have them, now they absorb fluid, they absorb water, they begin to expand, and they are easily more prone to having causing an effective environment. So for those ones you can, of course, it also helps you in urgency at removal. Non-vegetative can be bead. Sometimes you're seeing the bead could have been there for 2, 3, 4 months without even the parents knowing. And that's not giving pain at all. It could just be an accidental finding.
So in other words, foreign bodies may necessarily not give pains.
Yes.
They're just there.
They're just there. They could give pain one if they are corrosive, made of corrosive substance like batteries.
Okay.
That's acidic or alkaline. Those ones can cause corrosion. Or if attempt at forceful removal, from an inexperienced hand who now pushes and causes injury. It could even be the child in attempt to bring it out. We just get pushed and it gets stuck. That's basically when they may give pain.
Other times they're just there.
They're just there.
When you stop and they're not smelly, they're not discharging, they're not painful, could they really cause serious medical damage if left unattended to?
Yes. If left unattended to, some of them, not all.
Okay.
Yeah. For instance, like if it's a bead in the ear, you may just notice that the child is not really hearing very well with that ear, because the other one makes up for it. It's there over time. If it's a battery, for instance, these are they can cause chemical bombs around there, and of course infection setting and all, or even with those ones, if not, they can even close and narrow the ear passage, or what we call the external auditory canal. Yes, and then sometimes even in the nose, if they are there for a long, they can form what we call rhinoliths. That's like we have stones in the kidney. They could form something like a rhinolith, blocking that nose.
Wow.
Yes.
If you're just joining us, the program Your Health, and today we are looking at foreign bodies in ear, nose, and throat. We have a consultant in the house, Dr. Mikey Koku, who is a consultant surgeon, ear, nose, and throat, and also head and neck surgeon at Federal Medical Center in Asaba. Okay, we'll take a break now, but before we do that, we want to sincerely thank the Nigerian Medical Association Asaba Zone for graciously always loaning us our personnel. A break beckons now. We'll be right back. still wondering, my name is Lucy Erickson Ochinogo. I'm your host, and once again, I have Dr. Mike Iko, consultant surgeon, ENT, and head and neck surgeon in the house, and we're looking at foreign bodies in the ear, nose, and throat. Okay, we've told you that foreign bodies are something that is domicile resident where it's not supposed to be, and because it's there, it becomes an anomaly and definitely will cause damage to our body system. Of looked at different parts of lodgement, like we have peas, cotton, beads, then food, grains, rice, beans, corn, whatever. So at the end of the day, they just find their way. Would I say not carelessly or playfully? Even the roach, yeah, doctor also mentioned cockroach even crawling into your ear. I don't know. So from now on, henceforth, I won't be lying on the floor. I don't want one in my ear.
I don't know. Maybe we'll say at least keeping our environment.
Okay.
At least to reduce some of
those roaches.
Because sometimes even not just cockroach, because sometimes even mosquito, flies,
insects. Yeah, fly. I've experienced that of fly. Just perched it and I was trying to, and the thing was going in. I had to sneeze out forcefully for it.
So it's just so basically it's just say keeping the homes and surrounding clean and safe for human habitation and avoid pests and insects.
Okay, now I also know that anyone and everyone can be vulnerable to this foreign bodies, nose, ear, nose, and throat, from children to adults. It can happen to anyone. Now, medically, when a foreign body is sighted or noticed, what's the treatment pattern? What's the procedure? Because you've kept mentioning unprofessionals handling, pushing in further than it's supposed to lodge.
Okay.
Let's do it the ABC, first aid to professional.
No, yeah. So no, the thing is, first when it happens, we'll look at where is this foreign body?
Okay.
What is it?
Okay.
So when we know where it is, and it's maybe depending on how the presentation is, and then we see where it is. If we now know where it is, and then we say, oh, what is this?
Okay.
Sometimes you may know. For instance, a mother comes in and say, oh, my child has a bead in the ear. We just noticed it this evening, you know. Child is calm and playful. Child does not even know. First we'll do is, okay, take a look and confirm if there's a bead. Yeah. And then you can now talk to the parent. So this is what it is. These are the possible outcomes. We'll remove it. Okay. Yeah. Now, the idea is if you have the necessary instruments to remove them at the moment, you can do that.
Okay.
And so instrument means one good light source, and then the instruments, forceps, we could use to bring whatever it is up, depending on the object. You can do it right there and then. But if not, it's also reassure the parents and say, okay, no problem. Come to the hospital. This will not harm the child. Doing it wrongly will harm the child.
Okay.
Because let's presume the bead we are looking at now, and the mother they now maybe attempt to use pin or whatever. They could traumatize that ear. Or even push the pin and rupture the eardrum and push it into the middle ear. So something that would have been, you cause another more severe problem. Now, but if that same ear, and they come, they say, oh, we think it's a battery. It becomes an emergency because we are looking at the corrosive nature of the battery. Or if it is a living creature, for instance, someone have a cockroach crawling in the ear. It could even be a phone call. I mustn't be. Sometimes it happens at home. The person is like mad, you know, not stable, not because it's like the whole world is turning upside down with the movement within. So as if having something running in your head. So what you can do first of all, if they are home, maybe over the phone, it's okay. Oh, get something like maybe olive oil here, or you know, because all living things will need oxygen to survive. So you can suffocate the organism first. So what you can do is, okay, just pour in olive oil, even if it's this coconut oil, even if it's the idea is you suffocate.
Okay, the oil will help suffocate.
Yes, because once you do, it can't breathe.
it will now be forced to start looking for a
No,
way
it
out.
will. It may not be for, but at least that will kill.
The movement.
They kill the organism, kill the insects, and then that movement will not be there. Then you can. But if it's presenting in the hospital, you can still do same, and then you remove before you now remove the insects or whatever is crawling in there.
But when there is a non-moving object,
So when I say, oh, if it's a battery, you must do something as quickly as possible. If it's a bead, we can ask, okay, oh, if the batteries are not there, if it's grain, you remove immediately. They are vegetative. You don't keep. A child once had beans in the ear, and by the time the parents could realize what was happening, the ear was bringing out pus and was discharging. Just that the child was taught that you grow beans in a hole. And he had a hole in the ear.
And said to plant it.
You had to plant in the ear.
Beautiful. that child is quite creative. So it's open.
It's open. It's a hole. So he was actually watering it. So it was when the man was just telling me, my beans will soon grow. Nobody knew.
He was watering it.
He was watering the beans. Because when you plant, you water.
Yeah.
Then if it's in the throat,
Yes.
that throat could be an emergency.
Especially like bones.
Because because one outside pain, the individual, be a child or adult, may come with breathing problem. So you see someone struggling to breathe. So sometimes we may have to create an alternative pathway for breathing while before chasing after the foreign body.
Okay, for instance, that of the throat, bone lodging. Often they just say take a big swallow, take
And sometimes you take a big swallow, and no, that is after that, because somehow those are form of our assumedly first aid home remedy. But when they are coming to the hospital, they've tried all those swallowed bolus and all, and it's not pushing it down. So at the end of the day, you would need to do something. So some of them, like for the child, then I was a resident when I saw when that child came in. The child was having problems with breathing. It was a toy. The elder one we were playing with. I don't know how the noise maker and that thing that generates that noise got dislodged, and then the child swallowed it. What we did first was, then my seniors that was on call with, what we did then was initially to put a tracheostomy tube. So we gave the child somewhere to breathe. And then
that's the alternative.
Alternative airway. And then, of course, these were done in theater. Having secured the airway, we now had to remove
the foreign body.
The foreign body.
Okay, now just before we go, Dr. Koko, all foreign bodies removal procedure, is it always surgical? Is it just by surgery?
Well, when you say surgery, we are not saying they all go to theater. No, not all.
Okay, some surgeries are carried
some
out outside the theater.
Some may just be minor procedures. Sometimes you can even this regular flushing of the ear, the syringing, use of a syringe and then water into the ear for things like cotton bud, things like even the beads. That can be done.
Could be brought up by flushing.
Then flushing the ear, yes. Now, if it's beat, sometimes there are certain instruments we can use. We call one of them we call Johnson home probe. Then there's there's another one we call the crocodile forceps. Yeah, it opens the mouth like the crocodile. Just leave the name. Yes, they are designed to go into, because of the peculiarity of the opening.
It
goes in and then you can pick.
Okay.
Yes. Then if it's like a bead, now I may not be able to use that to pick because it won't be stable because of the surface. So you can just use the Johnson home probe, go behind it, and then.
Okay, it looks like a hook.
It's just as a flat edge that you can at least easily tease in between the wall and then the foreign body, and then you bring that.
And this must be handled by a professional.
Yes, basically someone who has the training. It mustn't be the ENT. Sometimes it could even be the doctor who had at least had that training. Even it could even be the nurse who had the training. But what we are just interested in is someone who has had the training and then has the right instrument. It's not just every forceps you say you pick. Because sometimes by the time they are even coming, they have gone to the hospital, they've traumatized the ear. You can't touch the child. He's feeling pain already and all, and wouldn't want you to do anything.
Okay, so finally, Dr. Koko, what will be your advice to parents, guardians, caregiver, everyone, even adults?
The advice generally, one will look at those we have some wonderful policies to help, like toys and all the rest of them. Taking care of a child. No child should be at home without an adult. Those are general things we should do
But we
first.
have to go to work too.
Then, yeah, but there have to be a balance. We have to raise children, we must go to work, but there must be a balance. So there should be someone who's there who looks at least to monitor what they are doing. Then two, these things that we know that are that they could use as foreign body, we should keep them beyond reach,
Okay.
beyond their reach, so that they won't have them. And then also, when these things happen, our response should be prompt. And of course, going to the hospital is still the best.
Okay.
It still remains the advice. Going to the hospital. Not that, oh, Mama John, that was how they did it, or Mama Janet.
Let's try
Or it was this enemy. I know that while I was eating this with somebody didn't like my face. And that's why
I'm choking now.
I'm joking now. And then, of course, table manners,
Table manners.
especially for the adults.
Okay.
Yes.
All right, so you heard it from our consultant surgeon. Today we have been talking to Dr. Mikey Koko, who is a consultant surgeon in ENT, and of course a head and neck surgeon here in the Federal Medical Center. We'll be looking at foreign bodies in nose and throat. How do you handle? Best form of handling it is go to the hospital. But if you can get to the hospital, if you have someone who has the basic training and has the right instrument for removal, that person can actually administer first aid. Above all, please, when you buy toys for your children, read. There are some toys, you see them, is read. The age bracket to use is there, but oftentimes we just, oh, my child will like it, don't even know if it's going to harm your child. Please follow the instructions on the toy and make sure that toys that are dangerous are kept out of reach of children when there is no adult supervision. On that note, we want to say thank you, Dr. Mikey Koko, for coming,
Thank you for
as
having me.
always. And to the Nigerian Medical Association, we thank you so much for always being there for us to give us the best resource person. On behalf of the crew, my name is Lucy Erickson, saying stay safe and stay out of trouble. God bless you.